Hello, everybody. How are you doing? My name is Teresa Chan, and I'm really excited to bring to you a very cool innovation from one of our McMaster alumni. Sarah Fui is an emergency physician at Credit Valley now, and she's just recently showed me and Dr. Ali Maji one of the awesome innovations that she's brought up. So Dr. Fui, can you take us through what it is that you've created and exactly what we're going to see today?
Of course. So this is our virtual recess room. So we have a shared Google Slide document that myself, the facilitator, and all the participants will have open at the same time. So you can see we have a patient here. We're going to walk through the case just like we would in the real sim lab. So when you want to check his vital signs, you can click and drag monitors onto the patient, and your facilitators will update the vital signs in response to these changes you do.
Blood pressure cuff there, excellent.
Yeah, blood pressure cuff, pulse ox, we can check his temperature, we've got a glucometer. If you want to place IVs, you can click and drag an IV in place. If appropriate, you can add other equipment like a Foley or an NG. If you're having a hard time with the IV access as guided by your facilitator, we have an IO option as well. If you want to provide oxygen to the patient, then you can click and drag whatever equipment you'd like to choose and then type in the flow rate that you think is appropriate. If you decide, someone in the team can be a charter and type information about the patient depending on what the case prompt is, and type in orders as you go real time. In response to these actions you're making as a participant, the facilitators will be making changes like revealing what the rhythm strip is or saying what the heart rate is. If you want to give medications, then all the medications are stored on the second slide of the virtual recess room, and you can select what medication you'd like to give. Let's say we'll start with some fluids, and then bring it back onto the original page and drag it into this medications given box to kind of represent the act of administering the drugs. Similarly, if you want to do an airway intervention, you have to go to page 3, which is our airway tray, and select what size of airway equipment you'd like to use and what method you'd like to use if you're doing an intubation. And you can select what you think is appropriate for the patient at hand plus a backup plan and bring it back to the head of the bed where you can talk through the steps of whatever airway intervention you decide to do. Participants themselves, if they can decide they don't want to use it, can just remove it from the first slide and everything will be where it was before.
Excellent.
And as you said, as the case develops, facilitators can unveil further slides and tell the participants to go to slide 4, slide 5, whatever's appropriate, to kind of move on to the next steps and guide them through the case.
Okay, so I just put everything back there, I think. Got this one back and this one. And this is the non-rebreather. I'll put that one back too.
Cool. Get rid of that. And we'll make sure the flow rate is set.
Turn it back off. There you go. Excellent. All right, Aleem, are you ready?
Ready.
Okay. All right, Aleem, why don't you be the team lead? I've been talking too much. I'll do your bidding. I guess
All right, so the case we're gonna run is a 65-year-old gentleman who's presented to the emergency department feeling like his heart is racing. He has a past medical history of diabetes and high cholesterol, and he hasn't seen his family doctor recently.
Okay, great. And did he come in from EMS or he walked in?
He's a walk-in, and when the nurse tried to check his heart rate, it seemed like it was quite high, so she didn't do a full set of vitals. They just brought him right into the recess room.
Okay, great. So let's walk into the recess room, introduce ourselves, put on appropriate PPE, and then if we can get the patient set up on monitors. So Teresa, can you throw some monitors on this guy so we can get some vitals on him?
Okay, so white on right. So, and then patient's right though, right? Smoke over fire. There you go. Monitors are on. Oh, wow. Okay.
Oh, okay.
Okay,
And
I'm going to get a temp on.
Alert? Is he talking?
He's talking, he's awake. He just said his heart feels like it's racing.
Okay.
And
oh, that's not good.
His pulse is matching what we're seeing on the monitor?
Yes.
Okay.
And did we get a blood pressure yet?
I've got the blood pressure cuff on there. It's cycling. It's going.
Perfect.
Hearing. Okay. There you go.
Okay, let's get him on the pads here because he looks like he's VTAC with the pulse.
Okay.
Let's just get the pacing pads on or the different pads on in case we need to here.
Okay. How do you want me to place those? Do you want me to place those like anterior posterior?
Let's do,
log roll.
Yeah, let's do anterior lateral.
Okay. All right. Okay, I'm gonna put it down here then.
And we're gonna put some oxygen on him here as well. So let's put the non-rebreather on him because he's setting 92.
Okay, you got that. I'm gonna take out the temp.
Yeah, I'll put
is gonna go away.
And then we're going to set this to 10 liters here. Perfect. Okay, good. So this is VTAC with a pulse. He's currently still stable. Let's get some more history just to make sure there's no contraindications to any medications that we want to use. Does he have any allergies?
No allergies.
And did he eat anything recently?
Nope, he just woke up.
Does he have chest pain?
No, it's just the feeling of heart racing, no pain.
How long ago did it start?
Maybe about an hour.
About an hour ago. Okay. And any infectious symptoms, cough, cold, runny nose, anything like that?
None.
No. Any other recent travel?
No travel.
No. Surgeries?
No.
No. Okay. And medications wise, it says diabetes and blood pressure, or diabetes and cholesterol, right?
Yes, he doesn't remember the name of his medications, but he takes 1 pill for each.
Okay, perfect. So Teresa, what are you thinking?
I think that if he is someone, right now he's screening COVID negative, he is someone that we could maybe call the RT down and sedate. I mean, there's 2 of us staff physicians, so we might not need if she's busy or he's busy. So let's put a page out to see if they can. If they can't, then we can probably just sedate and cardiovert this gentleman.
Sounds good. I was thinking the same thing. So let's get some drugs for this guy drawn up. I was thinking maybe some propofol, and then we can just cardiovert him. His blood pressure is holding right now.
Okay,
So
I
some
see.
propofols here.
Do we see it? I don't see it in the drug.
It's the top right. Middle. I'll copy and paste it over. There we
Okay,
go.
you
Some
do it.
propofol.
Okay, cool.
I'm going to drop 200 cc's of that. And then if we could get RT down, like you said, and then we got the pads on him.
Uh-huh. Okay, so we got the pads on. We'll just have to make sure we cardiovert. Don't forget that.
Yes.
He is starting to
So-
say that his chest feels a little bit heavy.
Okay, all right. Well, let's just probably, now that his blood pressure is coming down a little bit, maybe we can treat his pain, but I think we just need to sedate and shock. What do you think?
Let's do it. Let's give him 50 of propofol and let
Okay.
me know when that's in, and then set up the monitor for synchronized cardioversion.
Okay, so I'm gonna flip the monitor over and hopefully will the little light white dots appear?
Okay, so here's our monitor. If everyone goes
Oh,
to
okay.
slide 4,
Oh, it's
Oh,
on a
wow.
different thing. Okay, yeah.
and you
Okay.
can let me know if you'd like to use the sync feature or not.
Okay. So yes, I would like, hold on, I gotta turn this, right? The line to defib. Pretty
Yep,
awesome.
Turn
Okay.
it on to defib, and then if you'd
All right,
like to
cool.
sync, you can type in how many joules you'd like to use there.
All right, so I turned on the sync and now, what do you want to go? Go big or go home?
Yeah, let's do 200.
All right, 200 joules it is set. Okay, so is he getting sleepy, Sarah? I can't tell.
Yeah, you know what? Actually, just as the nurse reassessed him, she's not sure if she can feel a pulse.
Okay, all right. Well, then
there's no
we should,
pulse?
there's
Oh.
no pulse. Okay, so we've got him
Let's
shot.
defibrillate him right away then, yeah.
Okay, so we're gonna charge, and I'm doing chest compressions right now for the 30 seconds it takes to charge.
Okay.
So I'm doing chest compressions.
Chest compressions, you can type in what you'd like your rate to be and what your compression to ventilation ratio can be.
Ah, okay.
Oh,
You're
wow.
doing
Okay.
quality CPR.
So let's just go straight compressions for now while we're charging.
Yeah.
And then after that, we'll go to 30 to 2. But for now, let's just do straight compressions and then defib right away.
Yeah. Okay. 3, 8, 10. Okay, let's just go for it. All right. Are we
Okay,
charged up?
machine is charged.
Okay, it's charged. Excellent. Okay, and I'm gonna hit I guess the shock button. You guys can't see that I am, but my mouse is over it.
Okay, perfect. Shock delivered.
Okay.
So let's resume CPR.
Yep, I'm resuming CPR. Back to the CPR.
Okay. And let's call for help because we need more than 2 of us in here.
Okay.
So we'll see if any nurses or any RTs are around that can help us. And then
For
we'll
now,
switch to 30 to 2.
I'm getting the workout that I haven't been able to get during all of COVID. Okay.
I'll switch his airway over. So why don't you continue compressions? I'm going to switch him over to a bag valve mask
Okay.
so that we can do 30 to 2.
Okay. And has it been 2 minutes yet?
Not yet.
Okay. I'm continuing. You want to check out the BVM there, it looks like. Okay, cool.
Yeah, I got
Alright,
the
so
BVM.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, go ahead, Aline.
1, 2.
Okay,
Go
1,
ahead.
2, 3, 4.
All right, we can
5.
fast forward to the 2-minute mark to a pulse check, rhythm check.
Okay.
Okay, so before we hit the rhythm check, so just on our countdown in, let's kind of assign roles what we're going to do. So we're going to pre-charge the defibrillator in case we need to shock again.
Okay.
We're going to have a person to check pulses. So I'll check the pulses, Teresa, check the monitor, and then we'll also have amio and epi on hand ready to go if based on what rhythm we see.
Okay, I'm just getting the epi ready to roll if we need it. Okay. All right, we're going back to the defibrillator to take a look now. Okay, so are we ready for a pulse check? Let's do the pulse check.
So the patient has a pulse, the rhythm is shown.
Okay, so it's still this. Okay, so I think we should try it again.
Synchronize.
Okay, so this time we're gonna hit sync again. I'm gonna hit sync. Okay, cool.
Is he awake at all?
He's moaning.
He's moaning. And can we get a new blood pressure?
Okay.
Okay. So I think that's probably good for us to shock if he's not really fully awake yet.
Yeah, the propofol's probably still, I haven't circulated that great with my chest compressions, I'm sure. If you want to top it up a little bit, we can give him a little bit more, but I think we're ready to roll. So I'm going to charge. Is that okay?
Yep.
It's all charged up now by now, I think, because I hit charge a little while ago.
Charged.
Okay. Can Aleem get clear? The nurses get clear. Everyone all clear. Okay. I'm gonna deliver the shock. Okay. Anything change immediately on the monitor there, Sarah?
Not at the moment.
Okay. All right. Okay. He's got a pulse now, though. So Aleem.
So let's give him 150 of amio.
Okay. Let's find the amio.
And then if we can cycle the blood pressure again after that last shock.
Okay, where's
then, oh, it looks like we got a rhythm change here. I heard it.
Ooh, okay, you heard it. Okay. Okay. Where is the amio run? There it is. Okay. I have it here. It's ready to roll if we want it, but we haven't given it yet. Oh, is it rhythm? Has the rhythm changed? Oh, the rhythm on one monitor, but when I check the other monitor, okay. So maybe that's one of the monitors is frozen maybe.
Mm-hmm.
Okay.
Let's check a pulse too and see what it looks like.
Oh, look. Okay. All right. It looks kind of like more like sinus now. Okay.
Mm-hmm.
Okay.
And let's reassess our patient. Is he alert? Is he talking?
He's kind of still moaning a little bit, but the propofol is on board.
Okay, so let's get a formal ECG, and then listening to his heart and lungs. Do I hear normal S1, normal S2? Do I hear any fluid, anything like that?
No abnormalities on physical exam.
Okay, and then pulses are good in all 4 extremities?
Yes, and they're coming with the ECG machine.
Perfect. And disability, so is GCS?
It's like 14.
14, okay. And let's check a glucose as well and check his pupils.
Pupils are equal and reactive.
And let's check a glucose, so we need a glucometer. It's on this page, right?
Mm-hmm.
Oh, here it is, glucometer. Here we go, glucometer. So we're checking the glucose. I think I picked myself.
Oh, okay.
So your glucose is 6.1.
No, it's much lower. It's much lower.
Okay. We can end the case there.
Okay, all right, I'm gonna stop share. Well, that was really fun, Sarah. Thank you so much for taking us through it. Yeah,
I wasn't quite ready for the rhythms there, but we will be.
Yeah. So, I mean, like, I think as a teacher now, do you want to debrief a little bit? Tell us a little bit. So, I mean, for us, it felt pretty seamless. I think with the rhythm strip, that was like maybe the only one. And I guess like it's just a learning experience, just like anything else. Sometimes if there's 2 monitors in a real sim, in a mannequin sim, I would probably still have that problem, right? Because sometimes you forgot to switch the rhythm on both of them. So I don't fault you at all for that. That's just a real life sim person's sim problem, right? But yeah, like I really enjoyed how we could move everything around, how we had to like stop, pause, find the medication. It gives you kind of like that it feels almost like that real experience of, oh, I have to wait for the meds. Like, why can't you find the propofol? I don't understand, right? And so like those are the kind of things like I'll be like, I got it, right? Like and I think those are real like things that you could debrief about. Like sometimes like if someone, a new person doesn't know where the medications are, like with the nurses, or if you're not really sure which piece of airway equipment, I can see how this would be very useful to at least show people what it should look like so that they know what they're looking for, right?
Perfect. Yeah, and then I think as the facilitator, really what this shows is that you have to practice the case at least once ahead of time. So this is our first time running it, and you do kind of expose those things that'll make it a little bit more or less smooth. And then really ideally, the facilitator would know the case really, really well, so they can pay most of their attention kind of focusing on updating the vital signs in response to the actions.
Yeah, I think anytime you have like a case that you've run before, it's a lot easier. So you're right, that practice from the teacher of the simulation side is actually really important. So that's pretty awesome. All right, well, thank you so much for showing it to us. Aleem, do you have any thoughts that you haven't shared yet?
No, that was awesome. Really, a lot of fun.